I would like to acknowledge the traditional owners of the land we are meeting on and acknowledge their elders past and present and emerging, as well as any Aboriginal or Torres Strait Islander people attending today. Welcome to clinical placement at Westmead Hospital. Westmead is one of 4 public hospitals within Western Sydney Local Health District. Westmead is a 975-bed tertiary level referral hospital for the Western Sydney area, which has a population of about 1.85 million people. We are a major trauma centre with a fast-paced emergency department, high-level intensive care unit, multiple close observation units, and a dental school. Westmead is a major teaching hospital of the University of Sydney and is set to become the Westmead Precinct, which will be one of the largest health, education and training precincts in Australia. Whilst on placement, it is important to know your emergency and evacuation procedures. The emergency number is 2222. Your student photo identification badge supplied by your education provider must be worn and visible at all times at chest level. Your education provider uniform must be worn whilst on clinical placement. Long-sleeve t-shirts or undergarments must not be worn under your uniform. Policy is bare to the elbow. No rings, bracelets or necklaces are allowed except for a wedding ring. Earrings must be a small stud or small sleeper only. Nail polish and artificial nails are not permitted. We practice the 5 moments of hand hygiene at all times. This is the most effective way of reducing infection in our facilities. The use of mobile phones is not permitted at any time when delivering patient care or any activity associated with interactions between patients, relatives or carers. Mobile phones must not be accessed while in the clinical area. Students are not permitted to take photographs or enter any details or make any comments on any social networking site that displays or makes reference to any patient or person or identity that could be identified as being related to any patient or work-related activity. Western Sydney Local Health District and New South Wales Health have a very strict no smoking policy. Placements will be cancelled if this policy is not adhered to. Your shift information times will be given to you on your first day of placement. Shifts cannot be swapped with other students, and you must sign on in the ward daily allocation book. Please check with your mum or num or team leader. Whilst on placement, you will be under the direct supervision of a registered nurse. This can include casual or agency registered nurses. If you have any concerns or problems during your placement, please contact your facilitator and or your num or mum in the first instance. Please notify your facilitator and the num or mum or nursing team leader immediately of any accident or incident or any near misses that occur whilst on placement. Your facilitator will notify your education provider. All students must complete the New South Wales Health mandatory education modules in My Health Learning, including e-learning courses as required. Access to electronic medical records will be given to you using your StaffLink number and password. Do not share your login with anyone, and you must not use your access to search records of yourself or people you know. All entries in the electronic medical record must be checked and signed off by your assigned registered nurse. Students are on clinical placement to achieve mandatory clinical hours. You may attend ward in-service with your registered nurse, but students do not attend hospital in-services unless permission is granted by the facility coordinator. Food is available from Zuki's near the main entrance. We do not have a staff canteen. ATMs are available near the main entrance to the right and near Zuki's on level 2. Lactation facilities and the Masala prayer room are available if required. All facilities are accessible via public transport. We have limited public car parking, which is available at your own cost. Security does offer a service if you meet in the front foyer to assist you with getting to your car. We hope that you'll find your placement to be a valuable and worthwhile experience. If you have any questions or concerns whilst on placement, please refer at any time to your facilitator, nursing unit manager, or your assigned registered nurse. Thank you.